Good morning, everyone. Thank you for joining GG+A for this latest webinar, Fundraising for NorthShore University HealthSystem's COVID-19 Response. My name is Jeff Nearhoof, and I serve as a Senior Vice President with GG+A. Joining me today is Elizabeth Middleton. Elizabeth, we are grateful to have you as a client, and I value your partnership today. Welcome.
Thank you. I'm glad to be here.
Elizabeth has been working in philanthropy for healthcare and higher education institutions in Chicago for 15 years. As Assistant Vice President, Donor Development, she leads NorthShore Foundation's annual giving, major gifts, and donor relations programs. NorthShore is an integrated healthcare delivery system that is consistently ranked as a top 15 major teaching hospital in the US. It is headquartered in Evanston, Illinois, and includes 5 hospitals. The organization supports academics and research as the principal teaching affiliate for the University of Chicago Pritzker School of Medicine. As a not-for-profit organization, NorthShore provides more than $211 million in charitable care and services to the community it serves. NorthShore Foundation, the philanthropic department of the health system, includes 24 staff members who raised $19 million last year to support all aspects of NorthShore's mission. For audience members, if you have questions, please click on the Q&A button and we will follow up. So Elizabeth, we're going to go back to early March. We can see the key issues that you were facing. Please summarize the conversations going on between your staff, executive leadership, and hospital marketing, and also please specifically discuss your decision-making process about what the foundation should and shouldn't be doing, what your foundation message would be, and who would communicate it.
Sure, thanks, Jeff. It's been a journey since early March. It's hard to believe that it's only been about 5-6 weeks at this point since all this really started happening. Back in, towards end of February, first week of March, our communications director on our team in the foundation was asked to join a daily phone call with a group of administrative and clinical leaders across NorthShore who were tackling all the preparation for COVID-19 patients. And so he was able to keep our foundation team really up to date on all the preparedness, the changes in protocol that NorthShore was implementing, getting ready for COVID-19. And so that was a way that we were up to speed. We had our brain juices flowing about what we might want to share with our donors, and we had several members of our team who had experience back in 2009 in the H1N1 pandemic about their leadership communicating with their donors and volunteers about what the hospital or health system was doing, and so we felt this was something we might want to do, but we weren't quite sure yet who that message was going to come from, when it was going to come, what it was going to say. Around the same time, our chair of our Department of Pathology and Lab Medicine reached out to us in the foundation and said, hey, guess what? We have already developed our own in-house test. We are ready to go. We're waiting on some final FDA approvals. But we want to start testing patients ASAP. We know that this is going to be a huge need. And do you think any donors might be interested in supporting the equipment, the staffing, all the things that we're really going to need to ramp up this effort? And we said, yeah, I bet somebody would like to fund that. That's really exciting. So that was the first time we began thinking about the role of philanthropy in this crisis. What could donor dollars do to help NorthShore? And so we began thinking about some major donors. At that point, we'd already had an inquiry from a private foundation wanting to know what we were doing. So the team was beginning to kind of get our heads in this space of what could we what's our message if we were to fundraise for NorthShore's COVID-19 response? But as you see on the slide here, our first instinct was not that we were going to go big and bold and a mass appeal for COVID-19. We felt this was, an opportunity for us to follow the lead of our major donors who might inquire, those who are closest to us, and have some very targeted conversations. So that was our first instinct. And around this same time, we began to pull together what this messaging might be to a broader audience. We decided on March 11th, you'll see there, which also happened to be the same day that we reported our first inpatient case of COVID-19. We put out this message to about 1,000 of our key donors and volunteers. This was a pretty small group. The institution had not yet communicated with patients really, or the community very broadly about COVID-19. We didn't necessarily feel like that first message to a big giant group should be coming from the foundation. So we kept it small. And we were very surprised to see such a high open rate on that email. Typically we're, in the 20s, 30s. Percentage for our emails. So that was a clue that people were interested and they wanted to hear from us. So this message went out from our executive director of our foundation and really mirrored a lot of the message that was coming out from this operating group about our preparedness. And we really wanted the people who were investing in our mission as donors and volunteers to feel that we were ready and to feel confident that NorthShore was ready to handle this crisis. And so that really was the underlying message of the email. And also, wanting to give people some tools. We had at that point just set up a hotline and where people could call and talk to a nurse about their health questions related to COVID-19, and then also a public website. So we wanted to get that information into the hands of our nearest and dearest pretty quickly.
Okay, thank you. So it's a week later. Illinois went through a stay-at-home policy, and I know the majority of your team started working from home, but you also, quickly created a response fund because of the need that you had identified earlier. So the audience can see your initial success with some of the major gifts and also the impact of the mass appeals that you started sending. I'd like you to share with everyone how you kept your team organized and coordinated and to keep all these parts moving, especially now that the majority of people are working from home. Could you take us through that?
Sure. Yeah, that week was, it was something else. The week of March 15th. It was a blur, quite frankly, as I'm sure so many people experienced around that time. The schools here in Evanston, where we're located, were closing all around in communities all around us as well. So there were a lot of members of the team who were, of course, juggling what is now kind of our new normal of having families at home, spouses, whose job situations had changed. And so there was a lot of, trying to give team members space to figure it out. Yet at the same time, here we are working for a healthcare organization on the front lines. And so there was just this underlying urgency that we needed to be doing something to help NorthShore face this crisis. And we also had a kind of an additional element among our team in that we did have a team member who tested positive for COVID. We found out on that Monday that she was positive. Thankfully, she is doing great now. She is recovered, and we're thrilled about that. But there were a number of us who had contact in the last week with her. And so we had to enter into a 14-day isolation period. We were taking our temperatures, sending them to employee health. There were also a few of us who had symptoms of what turned out to be colds, thankfully. But there were a number of us who did end up getting tested that week as well, to make sure that that we did not have it. So that was really stressful. So we were balancing this personal, getting our lives figured out, trying to figure out who might have been exposed, who was healthy, who was not. And we were all figuring out how to work from home and connect with each other. So we were fortunate that a majority of our team had the ability to work from home, that we had a lot of the technical capabilities set up, but we certainly were not used to having all of us working from home, all at the same time. And in that first week, we were, we hadn't started using Zoom. We had not discovered that. So we were doing a lot of conference calls, a lot of emails, trying to keep things straight. And I was frankly just so amazed at how the team was able to pull together and roll out this COVID-19 Response Fund and a case for support and our first email appeals. So this all really happened in the course of just a few days. And it proved a lot to us. I really feel that we showed ourselves that we can be nimble, that we can pivot and adjust and get things done, I think, in a way that we maybe would not have thought that we could. So situations like this just force you to, be your best self and to try harder or be better than maybe you ever thought you could be. But at the same time, we also had to give each other space to grieve and to process and to figure out how we move forward with our families, with our communities in light of all this. So, so I just, remain incredibly proud of the NorthShore Foundation team. I think a number of them are on this call right now, and so I'm just going to take a moment to acknowledge them and their incredible work. That I just have the privilege of talking about here today. So our COVID-19 Response Fund that we set up really was established to be a direct line to NorthShore's, the breadth of the NorthShore response. So whether that was purchasing PPE, that was establishing our immediate care sites that were specifically set up to take COVID-19 patients and test those patients. We had to, our Glenbrook Hospital, which is one of our 5 hospitals, is really the hub for our COVID-19 patients. So there was a lot of work that had to be done to get all of the immediate care, or I'm sorry, the urgent, the intensive care rooms, that's what I wanted. The intensive care rooms all set up appropriately. So, NorthShore was, as so many hospitals and health systems are right now, just spending so much money to do whatever needs to be done. And so we set up this fund, our response fund on the foundation side, that just flowed right into the operating fund of the organization. So that for COVID response. So that felt like the most immediate and impactful way that our donors could make a difference and help keep NorthShore strong throughout this, so that we can emerge on the other side, as strong as we can possibly be. So at the same time, we were able to secure some gifts in kind for these UV disinfecting machines. So that was a great major gift we could book, and that gave us some really nice momentum and indication that that the community wanted to help. So we were able to get our message about this first appeal. This went out March 21st and March 23rd. So we sent it first to our donors, and then on Monday, March 23rd, to a whole bunch of non-donor patients who are in our database. So and we got the appeal up on our main northshore.org website and also on social media. So this is working in great partnership with our colleagues in marketing and PR. So you'll see there on the left-hand side of the screen, right there on the northshore.org homepage, donations from the community, and that went right to our appeal. And you'll see the email appeal there on the right-hand side. So we wanted the message to be really strong. We wanted visual images. We wanted, everybody was feeling urgency. Everybody was feeling that they wanted to be a part of this and to help. And so we really wanted to give the community that opportunity.
Great. So we're going to go a little later in March, and your team has been, working now for 3 weeks. Really dedicated, different kind of experience off, not together, a lot of remote work. And in this period, you decided to set a $1 million goal. Can you talk about the decision-making progress to actually set a goal in this period?
Yeah, absolutely. It was something we kind of went back and forth on a little bit. How do we do this? How do we tackle this? How do we keep raising major gifts in this time? We'd put a lot of our clinical specific appeals on hold. The major gifts team went through the pipeline and really looked at each and every ask that we were hoping to make this fiscal year. So our fiscal year ends September 30th of this year. So we're only halfway through right now. So we're looking at, just shy of 6 more months of fundraising that we can do this year. And, a lot of those understandably kind of need to be put on hold, or they need to be pushed a little further down the field. But our major gift officers were still reaching out to everybody in their portfolios, checking in, saying hi, how you doing, using this as an opportunity to connect. At the same time, we got a few major gift donors who came through, who were on our radar, but definitely not in our pipeline. Some of them may have been major donors in the past, but we hadn't had much success engaging them more currently. So we got 3 $100,000 gifts that came from people in the community who, one of them in particular said directly to us, I usually give to another health system in Chicago, but NorthShore is right here in my backyard. And I want to make sure that I'm supporting your organization at this time. And so that was a $100,000 gift. And we had another one where a donor reached out to one of our hospital presidents and said, what can I do? I want to help. And we had a major gift officer follow up with her. We ended up using that $100,000 to do a match email, which was really successful. We made the match in less than a day. So we felt that the community, we felt that the support was out there, and that people wanted to help in such a way that it would make sense for us to set a goal and to be able to organize our work around $1 million goal. Because at that point, we were already halfway there. We were just over $500,000 in the door, or verbally secured. And so we decided that this was the right time. So our major gift officers, along with our director of planned giving, our director of principal gifts, came together and had some strategy meetings, talked about existing pipeline donors, maybe some of those great prospects. We'd gotten referrals from physicians, but we just hadn't really, the hooks we were trying hadn't worked to get them engaged. So we thought, well, this is a perfect opportunity. This is absolutely an urgent need of the organization. Let's use this as much as we can to engage some of these people. And so the team came back with a pipeline of over $1 million in asks. And lots of really, really thoughtful work done donor by donor. And our message, especially to people, we did ask, there were people in our pipeline for this year for ask to a specific clinical area that we did go to, and we said, we hope you'll continue, supporting Dr. So-and-so's research. We will rely on that, but we also hope you'll consider joining us in this effort right now. We are looking to our closest friends, and that's our mentality has been, you ask your friends for help, and the people who have made big investments in us, the people who have entrusted us with their philanthropy are are our friends, and we wanted to make sure they felt that we knew we could turn to them. So we've had a lot of really great success with that kind of message, and people genuinely do want to help. And so we had, kind of definitely strategies for major gifts, for our mid-level giving program, which was, just really in its infancy. We just hired a great mid-level giving officer just in December. And so she and our head of annual giving have been building out this mid-level program, which for us is $1,000 to $10,000 donors. And so we wanted to make sure to keep that momentum going, because we had, put a lot of stuff in place and made a lot of progress. And so what they did is we have, a few hundred donors in mid-level portfolios, and they have done some really thoughtful outreach to every single one of those people, using just Outlook mail merged emails, but very warm and personal and friendly messages, and that has gotten some really nice response from people. We figure people are at home. People are looking for opportunities to connect with each other. So why not keep that going? And we've also had some thoughtful work from our planned giving director, who's been looking at a lot of the new and lapsed donors who have come in through our appeals, and looking at them based on their age level, and doing some outreach to those folks to say thank you, and to just use those new gifts to really connect with some potential planned giving prospects.
Terrific. So this last part is really about, where you're going from here.
Mm-hmm.
As the slide shows, you've hit your goal. You're starting stewardship calls. But I'd like you to spend a little bit of time as people read the slide, and what's changed for your team? Do you feel their communication or their fundraising skills or anything has changed given what you've been through for the last month?
Yeah. I mean, everything's changed. It's going to be hard. It's hard to say what will result on the other side of this, when we're all able to sit around a conference table together again. Because I know we miss that desperately. We miss being physically with each other, and that level of connection. But I think this experience has taught us so much about what we can do. I think I alluded to this earlier, that we've proven that we can tackle this really massive challenge together, and achieve it. I think it's forced us to accelerate our thinking. We were already in the process. As a foundation, we've gone through a lot of change in the last year. We've brought on some new positions, new team members. So we were kind of already in a place of some transformation as a team. And I think this is just going to accelerate everything we were already doing. I think we've been having morning huddles on Zoom. So every day at about 9:30, we all come online together and check in. What's up? What's going on for the day? What are our challenges? What are we hearing from our donors? What are we hearing from the organization? And that daily ritual, I think, has been beneficial for us. It's not something we would do when we were in the office together physically. And so, a team member has commented that he feels like he sees us more now, because we do have this morning ritual of every day coming together. We see each other's faces, and we connect. And so I feel like that's something that I hope we can continue as we move forward after this. and keeping those opportunities to connect with each other. I think we've bonded on a whole new level at this point. I mean, we've seen each other in our hoodie sweatshirts with pets in our laps and kids sticking their faces in the computer. And, so I think it's like you really bond with people when you see each other at your highs and your lows. And so I think from the perspective of us really supporting each other as a team, working together towards a unified goal, is something that we can really learn from and take forward. And I think this effort has also allowed us to continue to really build our culture of philanthropy at our organization, which is something we have been working on, and really, making staff members, physicians, others aware of what philanthropy can do for our organization, what the foundation does every day. And so by really actively raising money for this effort, by hitting our $1 million goal and sharing that with the organization, I think we've hopefully opened people's eyes a little bit more to what philanthropy can do for North Shore. So I think we've maybe become less risk averse. I think we've had to just take some risks. We've had to just try some things. I think we've got all kinds of members of the team working with us to do thank you calls now, reaching out, talking to people. I think the humanity of philanthropy, of fundraising, of connection has really been amplified in all that we do. And I think it's just going to make us all better fundraisers when we come out on the other side of this. For me and for many others on the team who've not really worked in a kind of crisis fundraising environment before, this was all really new, and so there's going to have to be a lot of self-reflection. There already is. I mean, I feel like we spend a lot of time right now. I know I do, and I think a lot of people around the world right now are doing a lot of reflection about what's most important and who we are as people and as a society. So, I think that instinct to give, that instinct to help is just such a beautiful thing that we're seeing everywhere right now. And I think we're just in such an incredibly fortunate position as people who work in philanthropy right now. It's really such a privilege.
All right. Well, thank you. At GG+A, when this crisis, really started, we were advising all our clients to double down on communication and stewardship and really stay informed and, advise clients to look at their mission. You're a case study in, all that advice, the work your officers have done with reaching out, the emails you sent, starting with communication and then appeals, and knowing specifically when people said, how can we help, you had an answer. And it's really been great to see, all your accomplishments, that hitting that $1 million goal, but, as important, you've really achieved something for the mission of North Shore that's really valuable. So I appreciate your time today.
Thank you.
We appreciate the audience for joining us. I appreciate your partnership, Elizabeth, and really this has been a thoughtful discussion, and I appreciate it, and I hope it was helpful to the audience. So I hope you have a good day, and to everyone in the audience, thank you for joining us.
Thanks, everybody.